Good afternoon, everybody, and welcome to our monthly webinar. Today, we are covering Medicare basics with our Director of Wealth Advice and Wealth Advisor, Gary Stoller. Gary joined Elevate just about a little over a year ago, and he's brought a lot to our team. We're so happy to have him here. This is his first webinar with us. A little bit about Gary. He came to us with a lot of experience. He lives in Athens or Watkinsville, and he has a wonderful family, a beautiful wife, Brittany, and 4 beautiful daughters. And outside of working at Elevate, he's very active in his church, and he loves grilling out, watching college football, and traveling. So I will let Gary take it away. Hi, Gary.
Go Dogs! How are you doing, Betsy?
I'm doing well. It's good to see you. Thanks for joining us today.
Yeah, you too. All right. So yeah, I'm excited to be here and talk a little bit about Medicare basics today. So are we ready to, can I share my screen with everyone?
Yes, absolutely. Go right ahead.
All right. See if we can start it here. All right, can we see that big, beautiful Elevate logo and Medicare basics?
We're all set. Thanks so much.
All right, fantastic. So obviously, Medicare is very important, very relevant to a lot of our clients, and a lot of our clients that will be aging into Medicare in the future. So, well, what is Medicare actually? So it is a national health insurance program for anyone who is either age 65 or disabled, which is like a kind of a severe mental or physical disorder, and also a U.S. citizen or a legal resident for 5 or more consistent years. So there are a few different parts to Medicare because there is multiple areas of coverage. So we have a hospital coverage, referred to as A doctor's offices, kind of outpatient coverage, referred to as B, and prescription drugs, D. That's an easy one to remember. That's the D for drugs. So, and there's some kind of maybe some additional benefits depending on exactly what you need and kind of the plan setup that is best for you. So, well, when should someone enroll into Medicare? So the initial enrollment is called the initial enrollment period. And this is typically when someone turns age 65. Now, a couple caveats here. If you are not covered by an employer plan or a group health plan of 20 people or more, or if Medicare is just simply better coverage than what you have, if you are on a group plan of 20 people or more, then aging in turning 65 is when you're going to want to enroll. And so there's actually a 7-month period for this initial enrollment period, which is 3 months before your 65th birth month, then the month you turn 65, and then the following 3 months. So that is your initial enrollment period, which is typical for most Americans for the time to go ahead and enroll. If you are already receiving Social Security income, Social Security benefits, when you are aging in, turning 65, then you are automatically, the default is to automatically enroll you in parts A and B, which is your hospitals and doctor's office coverage. However, you are not automatically enrolled in a drug plan or Part D or Part C, which is another option called Medicare Advantage. So if you are going to want prescription drug coverage or a drug plan or a Medicare Advantage plan, you need to proactively go ahead and sign up for Part D or C if that's the route you're going to go. So here on the left side of this blue box, we're going to see when you sign up. If you sign up before your birth month, let's say the 3 months leading up to it, then your coverage will start on the first day of your birth month. But there's an exception. If you happen to have a birthday on the first day of the month, then your coverage starts the month before, the first day of the prior month. Okay, so if your birthday is on July 1st, then your coverage will start on June 1st, as long as you're signed up before June 1st. If you sign up on your birth month, then the next month, and the month after your birth month, etc., you'll be starting your coverage the first of the following month. The best time to sign up, just to give yourself a little bit of cushion, give yourself a little bit of time to be able to plan for exactly what type of coverage you want, is just 3 months before you turn 65, go on and sign up. Hope that makes sense. Another enrollment period called special enrollment period. So, as I mentioned before, if you or your spouse are covered by a group plan of 20 people or more, and that health insurance coverage is better than Medicare, then you can stay on that plan until the coverage ends or until you leave or retire. And for 8 months, starting when that coverage ends, you have a period called a special enrollment period to be able to sign up for B, but only 63 days for the Part D, the drug coverage. During this time, if you're 65 and you are staying on your group plan, if you have 20 people or more, then you may want to consider signing up for Part A during that period. Why? Well, as long as you work for 10 years or more, Part A is free. There's no cost. And this could enhance your coverage as far as hospitals go as the secondary coverage. So maybe your group plan will be your primary insurance, and your secondary insurance could be Medicare Part A at no additional cost to you. However, if you happen to have a high deductible plan and an HSA, a health savings account, and you sign up for Part A to enhance your coverage, you will no longer be allowed to contribute to your HSA. So a health savings account, just a quick overview of that, it allows you to put money into that account before it is taxed. You can invest that money and grow it without paying tax. And then you can pay medical bills with that tax-free. So that is tax-free all the way around. So if you happen to have a high deductible health plan with an HSA, you probably, and you're contributing to it, you probably do not want to sign up for Part A while you're still on your employer's plan. So your coverage with the special enrollment is going to start the month after you sign up for Medicare A and B. You're going to want to sign up before your coverage ends. This is just going to avoid any gaps in coverage, and the Medicare can pick up where your group plan leaves off. So this is just a simple overview of your initial enrollment period and special enrollment period, depending on kind of when you retire and if you have a plan with 20 or more people on it. Well, wait a minute, Gary. I think I missed my initial or special enrollment period. What happens? Great question. There are consequences. There's something called a general enrollment period, which is the first quarter of every year, January, February, March. So if you missed your initial or special enrollment period to initially sign up for Medicare, you can still get on Medicare. And depending on how many years late you are, there is going to be an additional cost or fee around 10% per year that you are late. And this is going to apply both to your Part B premium and your Part D for drug premium. I'm going to get into all the premiums here in a minute. All right. Well, what's the easiest way? How can I go ahead and enroll when I am ready to sign up? You can simply call that 800 number, 800-772-1213. Or you can simply go to ssa.gov, ssa.gov. You will see this screen. And right in the middle, you have apply for benefits. Pretty straightforward. Now, let's kind of break down the numbers and the different parts and take a closer look here. So parts A, B, and D are what we're going to talk about. First with Part A, which is your hospitals. Like I said, if you've worked for 10 or more years, it is a zero premium, and then it is kind of prorated for each year less than 10 years. So if you've only been working, let's say 8 years, there's going to be a very small kind of per event or per spell of illness. And in 2025, that deductible is right at $1,700. And then you have some co-insurance as well, depending on which day in the hospital you. Typically, people are not in the hospital for long periods of time, but if you are past 60 days, that's when your co-insurance comes in. So let's talk about doctor's offices now. Part B. So this year, 2025, the Part B premium is $185 a month if your income is below the threshold, which is $106,000 for a single. It's double that for a couple married filing joint, which is $212,000. So there is a Part B premium, but if you've worked for 10 years or more, there's no Part A premium. So there's a deductible each year, around $250. And the Medicare will cover 80% of doctor's office Medicare approved expenses, and you're responsible for 20. Okay, so that's a summary of A and B. So let's talk about drugs, prescription drugs, Part D. So the premium is going to be different because this coverage is actually coming from private insurance companies, and there's a lot of them out there: Humana, Blue Cross, United Healthcare, SilverScript, all kinds, Aetna, Cigna. And then the deductible, copay, things like that is going to depend on the private insurance. Now, I'll say this. A lot of these plans are going to have different tiers, levels of drugs, generic, and then name brand drugs. So there might be, let's say, 3 different tiers of drug costs, and it can be kind of complex. And so you want to put some research into a drug plan, if that's what you're going for, to make sure the prescriptions that you need are going to be included, first of all, and at what tier and what level. So do yourself a favor and really put the time in to research those drug plans, and don't sign up for the first thing you see. So now we have an option to cover these gaps. So we have deductibles and co-insurance as far as gaps go. And therefore, there's an option to supplement your Medicare to cover the gaps. And so this is called a Medicare supplement also called a Medigap policy. 120 or so a month, or up to 130, 140. And these premiums increase over time. Sometimes it makes sense after 3 or 4 or 5 years, if your premium has increased significantly, to shop around for the same plan with another company if you can qualify to get a lower premium. So, like I said, it's guaranteed acceptance. So pre-existing conditions must be approved when you initially enroll. However, after that, you must go through underwriting and be healthy enough to be able to switch and apply and be approved for another Medigap or Medicare supplement policy. When you have a Plan G with Medicare A and B, really the only thing you're looking at paying is this $257 a year Part B deductible. So that's the most comprehensive. Another thing with a Medigap or Medicare supplement is every doctor in the US that accepts Medicare patients has to accept your Medicare supplement. They can't reject it. It doesn't matter what company it is. If it's a Medicare supplement or Medigap policy, then if the doctor accepts Medicare, they have to accept your Medicare supplement. That's not the case with Medicare Advantage, which we'll talk about next. But for Medicare supplements, that is required for the doctor, hospital, etc. And most of them do. A Plan G with United Healthcare is the exact same plan as a Plan G with Blue Cross, Aetna, Cigna, all the companies out there, Humana. There's a lot of smaller companies as well. There's no difference from one Medicare supplement Plan G to the next Medicare supplement Plan G. It has to be the same, standardized federally. That's not the case for Medicare Advantage. This picture you're looking at now is the most complete setup. For Medicare, it's the most comprehensive. So as long as you can, as long as your budget allows for that Medicare supplement premium, this is typically what we recommend. Now let's talk about Medicare Advantage, also called C. Medicare Part C, you know what the C stands for? Confusing. Well, I'm kidding, but it can be. So the first thing you're going to see here is there's going to be HMO or PPO networks. Now, the Medicare Advantage is intended to kind of be a packaged deal. However, pretty much every Medicare Advantage plan is different. A Medicare Advantage plan is not standardized by the government, and it's really not supplied or offered by the federal government. It is a private insurance plan. And so each one is unique, each one is different. And so you have to do your research and look at all the different benefits, co-pays, co-insurances, deductibles. A lot of times, prescription drug coverage is included in some way, shape, or form. It's usually not complete. There's co-pays, deductibles, and co-insurance with all three: hospital and doctor's offices and prescription drug coverage. Sometimes they'll include like dental, vision, and hearing benefits, or one of those, or 2 or 3 of those. Which that's kind of an additional policy you can also purchase if you're on the left side doing original Medicare. You can go out and buy your own dental, vision, and hearing coverage plan. But sometimes there's extra little benefits like that, or a gym membership or something like that, or a program. So while the premiums are usually lower here with Medicare Advantage, it is not comprehensive at all. It's just highly variable and unpredictable. I have to make this comment as far as the networks, HMO and PPO networks. Not every doctor has to accept your Medicare Advantage plans. The majority of them may not, if you go the Medicare Advantage route. So let's use Humana, for example. Humana would have their network for your Medicare Advantage plan. And it'd say, within our network, we have these doctors in your area. Boom, 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 boom. And you have to go there, or else basically you don't have coverage, or you're just paying astronomically more to doctor's checkups and things, visits. So you have to be within their network. And then number two is their networks change. They can change their networks. They do change networks, and doctors go in and out of network. This can happen throughout the year, and people can be quite frustrated with it. So it's just highly variable and unpredictable. Technically, it's probably lower premiums, but the co-pays, co-insurance, deductibles, and the unpredictable network changes may not be worth it to try to save a little bit on premiums. So before I mentioned that the premiums can be higher if your income is higher. So I know this is a pretty full chart here, but let's just look at the first line right here. Okay, so the first column is if you're single, your tax filing status is single. Magi is actually not the wise men from the East. It is modified adjusted gross income. So that, if you kind of know, AGI is a little bit more common to throw around. Some people know their AGI, but not their Magi. It's probably very close, and it may be exactly the same as your AGI. But if your income for 2025, like I said before, was 106,000 for a single, then your Part B, which is your doctor's office's outpatient services, premium from Medicare is 185 a month. Okay, so there's no additional IRMA, they call it, income related Medicare adjustments. In your Part D, there's no cost to be on Part D to be able to purchase that private insurance drug plan. So therefore, your total Parts B and D is your $185 a month. So it's exactly double if you're married filing joint for the limit. So for the rest of this chart, I'll just focus on joint. That's probably more common for the clients we speak with. So if your married filing joint income is tucked in here between 212 and 266, then you have an additional $74 a month for that year, that calendar year, on top of your 185 for Part B, an additional $14 or so a month to be on Part D. So now your combined premiums is this 272. So for the rest of this chart, it's just different income ranges. So between 266 and 334 if you're married filing joint. Then the additional is here and here. And so your total per person would be here. This is where I don't want to get into tax planning on this call, but this is where tax planning can come into play and really matter. This chart trails by 2 years. So practically speaking, how does Medicare know how much to charge you this year if you're 65 or older, if you're on Medicare, for your Part B and Part D premiums? How do they know? You don't even know exactly what your dollar amount is going to be, your Magi for this year. Well, do they know last year's? Well, it depends on when in the year, right? Taxes aren't due till April. And Medicare runs off the calendar year, January 1st to December 31st. So starting January 1st, how much do they know to charge you? Well, they don't know your last year's income yet. They don't have the tax return. But do they know the previous year? And that answer is yes. So they look at 2 years ago from today, what your income was that year, what your magi was to put you in these brackets. Okay, so as far as tax planning goes, you want to look at your magi for this year, and then you can kind of see what your Medicare premiums are going to be 2 years from now. All right, so there's a little bit of tax planning thrown in there. So each income range here is going to tell you what the extra is and what the grand total is per person per month. So you see how this can add up. If you're close to these limits with your magi, maybe talk to your financial advisor, say, hey, can we do any planning to make sure I'm not going over and jumping into the next Medicare premium bracket, which is what this is, basically a Medicare premium bracket. So be mindful of these numbers here. If you're 62, does it matter what your income is that year for Medicare when you turn 65? That answer is no, because that'd be 3 years before Medicare. So you could have an extremely high income year when you're 62. And if your age 63 and 64 incomes is under these limits, you don't pay any more for Medicare. In retirement, if you have an extremely high income year 1 year, you may be way down here somewhere. But if the following years are lower, then you're back up here. All right, enough on that. Last thing I want to touch on, which this presentation doesn't go into much depth on, but it's long-term care costs. So this is a Genware study, which I believe is the most accurate, comprehensive study on Medicare costs in the United States. And so this is kind of a national average or median technically. How much per day? So as you can see, long-term care costs can really add up. And if you notice when we were going through the Medicare parts, long-term care is not really covered by Medicare. So if someone has real low income, they may they may be able to get some assistance to take care of long-term care. But if you don't, which most of our clients don't qualify for that, then long-term care costs do come back to you. So planning for this is very important. If there's a chance you're going to need long-term care. Some people are convinced that they won't. Roughly 70% of Americans 65 and older do. And so you want your financial plan to be able to address this either by self-insuring. Maybe you have assets that you're just kind of planning on using if you need long-term care, or maybe some type of insurance. There's traditional long-term care insurance. And then there is some hybrid types of long-term care insurance, like life insurance and long-term care insurance hybrids. And that's something we can speak to as well. But long-term care, Medicaid is kind of like I mentioned for lower income that may qualify for that, but the level of care could be different. You may not be in the type of facility that you want or receive the type of care that you want, or something that's important to me is get the type of food I want if I'm relying on that. So anyway, that's something we're thinking about, kind of a whole different section. We have a presentation that we kind of all on long-term care. And so this is, to be clear, this is not included in Medicare parts A, B, or D, or the supplements. So hopefully this is helpful and insightful and relevant to those. And thank you so much for listening. Hopefully not too many of y'all fell asleep there. And I want to kick it back to Betsy here.
Thank you
So
so much, Gary. That was great. It looks like we have attendees in a variety of age brackets. So we might have specific questions from people based on what they're currently going through. So if anybody does have a question for Gary, we have a chat box and then a Q&A box. So feel free to drop a question in there. Gary, we do have one question. So if I'm traveling on a trip, is Medicare going to cover me if something should happen to me?
that's a great question. It's worth thinking about, especially if people travel a lot in retirement, and that is a common goal. So there actually is some coverage, but it's different. So for the first $250, that's your deductible if you're in a foreign country. Let me back up for a second. There is only coverage for the first 60 days of a trip. If you're on a long-term trip beyond 60 days, and something happens after the 60-day mark, there is no coverage. So it's only within the first 60 days, and it must be an emergency. Can't be a checkup or something that's not an emergency. So Medicare approved emergency within the first 60 days is going to have, there's basically three different levels. Number one is the first $250 is on you. Number two, for the next $50,000, Medicare will cover 80% and you must cover 20. And then beyond that 50,000 mark, there is no coverage. So it's all on you. So if that's something that you're comfortable with and understand that going on a trip, that may be sufficient for you. If not, you might want to talk to your travel agent about travel insurance. How can I supplement that and have more complete coverage there? Great question.
All right, very good. And I do know there are great policies out there. There's also there's policies that will come and get you, send a private helicopter. I mean, you can get as extensive as you want if you're worried about something like that happening. So, all right, that looks like all the questions we have. And if something pops up later and you'd like to ask Gary a question, you can email marketing@elevate-wealth.com. We'll make sure Gary gets your question answered. And then, of course, all of our advisors at Elevate are equipped to help you through any of this. So you can go to our website and click Let's Talk to schedule a private consultation with us at no charge. And we look forward to seeing you all next month for our next monthly webinar. It will be year-end planning tips with Brian Rosso. Thank you again, Gary, for all of your help today. We really appreciate your insight, and you did a great job on your first webinar.
Thank you. It's a good time.
Thanks, everyone, and we'll see you soon. Take care.
Yeah.
Bye.